Welcome to the live checkup. This is where we sit down with Dr. Asante Le Blanc and ask all the possible questions we can when it comes to our health and care. Let me just tell you this first off. Dr. Asante Le Blanc is the medical director and owner of Victoria Clinic, your home for holistic health care in Trinidad and Tobago. Victoria Clinic is located at 54 Galley Street in Woodbrook. Dr. LeBlanc is a medical doctor and certified medical herbalist. She is an integrative health care practitioner, bringing together the eastern and western branches of medicine so as to better guide patients on their path to optimum health. She's also a certified clinical densitometrist, specialist in diagnosis and treatment of osteoporosis. At Victoria Clinic, services offered include medical consultations, traditional Chinese medicine consultations, acupuncture, medical herbalism, blood tests, electrocardiograms, lung function testing, and Dexter bone density testing. You can contact Victoria Clinic at 622-2221 or 622-0683. Follow them on Facebook, Victoria Clinic, or Instagram, Victoria Clinic_Trinidad. Website, www.victoria-clinic.net. This is the live checkup. I'm JD. Now, let's jump into today's conversation. Don't get it. Hey guys, good evening and welcome to the live checkup. I'm JD. This is Dr. Asante Le Blanc. Welcome to another episode where we speak about, those questions that you may have pertaining to health, but it's always good to get the information on this platform, whether it's locally or internationally. That's one of the powerful things about the live checkup. So you heard all there is to know about Victoria Clinic, its location, and what you certainly get there with Dr. Asante Le Blanc and her entire team. Now it's time for us to jump into another very important conversation, Alzheimer's. It is Alzheimer's Awareness Month, if you did not know that. And I think it's actually on the 22nd, it's August, it's Alzheimer's Awareness Day. So today, we are diving into the conversation as it is just one of those things that many of us may have serious questions on. I certainly do, and I want to share those questions with Dr. Asante Le Blanc. If you do have questions yourself, you can please post that below as well. So good evening, Dr. Le Blanc. How are you doing?
Good evening, JD. Good evening, JD. Good evening, everyone. I'm fine. Good to be back. It's been a few weeks. It's been a bumpy road. And I'm sorry, I'm thirsty, so I'm still drinking my coconut water. So excuse that while we have our chat.
We have an internal joke. You will never hear about it, but we're going to keep that happening.
Oh, you're going to hear about it.
So we'll just leave that alone. But it's good to be here. All right. And let me just look and make sure. Yes, we're good. So, Dr. Asante Le Blanc, we've only got about 30 minutes today, so it's going to be a short of conversation that we're having. But let's dive into Alzheimer's. What is Alzheimer's? And maybe you can even dive into dementia at the same time. Is it the same thing? What is it?
So, thanks for having. Well, thanks for us doing it again because we've been very busy. So dementia is the umbrella term that is used to define disorders that affect your memory, your critical thinking, and your social thinking, and it impacts on your normal daily life. And under dementia, we have Alzheimer's as a form of dementia. And Alzheimer's disease accounts for 60 to 70% of dementia cases.
All right.
So Alzheimer's, go ahead.
No, I'm going to say that's a large percentage, but just go ahead with that.
So Alzheimer's disease is exactly that, where we see a slow and steady decline of, it's a neurodegenerative disorder where you see a slow and steady decline of your memory, your critical thinking, and your social capabilities. And it does impact on your daily lifestyle. So we have different clinical stages for Alzheimer's.
And those are?
So the first stage is the preclinical stage, and that's where the changes are happening in the brain, but there is no sign or symptom, so to speak, as yet. And then we have mild Alzheimer's disease, which includes memory loss, and it's usually recent memory loss. So we call that anterograde amnesia most times. So it's recent issues, recent time. So it's like a week ago, a day ago kind of thing. Confusion about location of a familiar place, taking longer to accomplish normal daily tasks,
Hmm.
inability to, like, trouble handling money and paying bills, compromised judgment, which leads to inappropriate decisions or bad decisions, loss of spontaneity and initiative, and mood and personality changes, which include increased anxiety. And that usually lasts about 2 to 10 years. Then we go to the moderate Alzheimer's disease, which can last between 2 to 6 years. And that includes increased memory loss and confusion, shortened attention span, problems recognizing your friends and family members,
Right.
difficulty with language and problems reading, writing, and working with numbers, difficulty organizing your thoughts and thinking logically, the inability to learn new things and to cope with new unexpected situations, restlessness, agitation, anxiety, tearfulness, wandering, especially in the late afternoon and the night, repetitive statements or movements, occasional muscle twitches, hallucinations, delusions, suspiciousness or paranoia, irritability, loss of impulse control. So you can undress at inappropriate times, you say things, you could become violent, vulgar language, perceptual motor problems. So trouble getting out of a chair, setting the table. And that lasts about 2 to 6 years. And then we go on to severe Alzheimer's disease, which can last 2 to 4 years. And that includes everything we mentioned before, plus weight loss, skin lesions, seizures, difficulty swallowing, groaning, moaning, and grunting, increased sleepiness, and lack of bladder and bowel control.
You
So
mentioned
those are the 3 stages.
well a lot of the details inside of the stages, but is it usually or is it fatality the final guaranteed with this?
Yes, yes. So you will have death inevitably. But it might be due to an infection, sepsis, heart
Right.
attack. It's not. It's usually not. It's Alzheimer's. It's a a neurodegenerative disorder. But the death usually occurs due to the complexity of the lack of neurological function. So that means because you forget to do so many things and you're bedbound, bedridden, eventually, then death will occur.
Do you have a long is there a period of time, meaning how long can you live with Alzheimer's? Does it depend on the
You
individual?
can live up to 20 years or more with Alzheimer's. Yeah.
Okay. So one of the things that I keep hearing about is, the question between male and female. Can you just tell us if it's more so of a male disease or more so of a female disease, or is it just across the board to both sexes?
It's across the board right now. There may be a little predominance towards the men, but it's across the board.
Is this disease all based on genetics?
Oh, no, no, no.
Yes.
So
So
the what causes Alzheimer's has not yet been fully determined. We do know the pathophysiology. That means we know that it's about tangles in the brain, these neurofibrillary tangles. But what causes it could be about the bad coding of a protein. But we're seeing slight genetic components related to that. But also we're still looking for other causes, like what causes that miscommunication and miscoding of the protein, which then causes the protein to not function properly in the brain, and then causes the lack of communication amongst the neurons. And there's all these tangles and in the brain matter, the gray matter, and that is where the disease symptoms show up.
all right, so it's going to be it is still a constant research that is
Oh,
behind.
definitely, definitely. Alzheimer's is being researched consistently, consistently, consistently.
Question: what are the ages when you look at someone who may get Alzheimer's? Is it just purely for the elderly, or attached to the older
No, so we have early onset Alzheimer's, which can start as early as the 40s, and then we have late onset or what we call regular Alzheimer's, which can start around the 60s, 70s. It's important to understand that as your family physician, why it is that we're able to speak on these topics is because we have to know what is being expressed, what is being seen, and then be able to liaise with the specialist, because we're like your communication with the specialist. And almost every disease is treated from a multidisciplinary approach, meaning the different specialties of medicine determine how you're best treated from a holistic standpoint. So
Right.
in the case of Alzheimer's, we use the family doctor, the neurologist, the occupational therapist, psychologist slash psychiatrist, and we go, and then your caregiver is very important as a component. So it's important to understand that, everybody says, but I forget names. I forget this. I forget what that was the other day. I forgot her name. But you have to understand that there has to be a pattern. You see the pattern, you see the degeneration, you see the worsening of the symptoms. So it's important to visit because your doctor every year, because then the doctor will do different things that you don't understand, but you're being tested on your memory, your social skills, your critical thinking, and then we rule out other causes of dementia, other causes that can be treated. So simple things as vitamin B12 deficiency, deficiencies of other micronutrients in your diet, other diseases. If you have diabetes, hypertension, we look to see if that is, you have some vascular disease of the central nervous system. Therefore, you're getting some sort of vascular dementia, multi infarcts in the brain. So it's important not to assume that every single memory loss is Alzheimer's and that not every single dementia is Alzheimer's. And important to understand that dementia is not equal to old age
Mhm.
memory loss. So as I get older, depending on how proactive I've been in my life, I may lose some memory, I may forget certain things, but there's certain characteristic symptoms and signs that are demonstrated on how your critical thinking is affected, your memory is affected, and that is how the diagnosis is made for
Doc-
Alzheimer's.
Dr. LeBlanc, is there something that we should be doing in a younger age to try to eliminate or at least push that as far back as possible with our brain health?
Well, I always say, and we have spoken time and time again about mental health,
Right.
and we will always speak about it because health, the definition of health is the balance of body, mind, and soul. And this is important. So it's about doing the puzzles, the Sudoku, the crosswords, the search a word, reading, poetry, communication. It's important to do mindfulness exercises, meditation, yoga, tai chi, qigong, to
Mhm.
take time out of your treadmill schedule to relax and be mindful, to let the brain regenerate, to eat as healthy as possible, know where your food is coming from when you put it in your mouth, to understand that stress is not equivalent to Alzheimer's, and that your central nervous system and that your brain is a big part of that needs to regenerate and recuperate. And that is what effective sleep is about. And all of these practices that we speak day in and day out, we speak week after week about, are important for you to be proactive. Balance, the word balance comes back. Exercise, healthy eating, no smoking, mindfulness exercises, yoga, tai chi, qigong, sleeping well. All of this will protect your brain function and help you in your proactive behavior against the degeneration of your brain and brain tissue.
Because many of us may be walking around thinking we're fine. Who's walking around on 2 hours, 3 hours sleep, not realizing the damage that we're possibly causing in the future. Um,
Over time,
yeah.
over time.
So, can you speak about some of the treatments that we can possibly that you can mention to those persons who are seeing signs? Maybe they have a family member who has Alzheimer's, or maybe one in within themselves can, because you just mentioned vitamin B as one of the pre-active sort of approaches. But what sort of treatment can be applied to those that are currently going through it right now?
So when I mentioned vitamin B, I said that could be a deficiency that led to a certain sort of dementia.
Okay.
So what happens is you have to have a physical exam. You have to probably be sent for a CT scan or MRI of the brain, and you have to have certain different. Some people we do a lumbar puncture to make sure that there's no other underlying disease of the central nervous system. And then the neurologist will ideally be the one to make that definitive diagnosis at the time.
Right.
But the true diagnosis is made post-mortem when we see the brain and the sections of the brain. That being said, there is no treatment for Alzheimer's as yet. There are many things that are being experimented and being tried, and clinical trials are being created. However, we use different drugs to help with the functioning of the brain and the communication and the helping of the certain sections in the brain that help with memory, critical thinking, and so forth.
Right.
And then if you have certain things like anxiety, depression, then we use anxiolytics, antidepressives. You know, if you're having you're not eating, we may want to increase your appetite with certain vitamins. If you have vitamin deficiencies, we will give vitamins. If you're not eating, we have to look at supplementation. So it's all multifaceted and a multidisciplinary approach to that.
And one of my final questions would be, as we live, and of course you're very much busy dealing with COVID-19 as one of the doctors inside of this in Trinidad and Tobago, having to deal with it consistently, whether it's talking about it, guiding us on it, maybe seeing, I don't know, whatever it may be. Can you connect that, your experience or your current state of mind with COVID-19, and speak to those persons who may be caregivers, whether it's they're by profession or just simply saying of care, taking care of your loved one? What sort of practices must they instill or maintain to make sure that COVID-19 is not an additional thing they have to deal with their patient?
JD, it's everything we speak about. I mean, and I don't want to go on a rant, but it's everything we speak about. It's everything we say day in, day out that everybody has to adhere to. You know, people need to understand that COVID-19, we have a high risk population, but that's not high risk to get it. That's high risk that if they get it, they may develop certain complications. And more now that we have community spread of COVID, and we now have positive cases being quarantined at home. If you don't become responsible about that, then it's all for naught. So it's the same thing. The caregivers out there have to understand physical distancing, the washing of the hands, the coughing into the crook of the elbow, the using of the mask. You have to understand that, and understand that an Alzheimer's patient who is moderate to severe may not understand why they need to use a mask.
Mm.
Don't go outside if you don't have to. Don't put them on the porch and let them take fresh air and then take them back inside. You know, we have to understand that it's everybody's responsibility. It's an individual responsibility when it comes to COVID right now. And this action that the government and the ministry is taking is one where they're asking you to be responsible for you and for your brothers and sisters of the population. And it's very simple. So to the caregivers out there, it's the same thing. There's no special rule. It's the same thing. And you have to do it.
All right, so basically that's it with our conversation inside of the live checkup. I know you've got some things to do, but thank you so much for the info as always. Are there any final words you'd like to simply wrap up with as we step out of the live checkup for today?
Yes, I just want people to understand that Alzheimer's disease is a form of dementia. It's not the only type of dementia. Alzheimer's is a very slow, progressive neurodegenerative disease. And this is why it's important for you to talk to your loved ones, have that communication so that you see any early signs and symptoms, because more and more there are therapies that can be used earlier on to delay the onset and progression of the disease most times. So I want you to understand that, look at it, understand if somebody is not remembering too often, you're seeing a pattern, go to your family doctor, speak with them, and start the process from there. I know everybody wants to know about what herbs can be used to support the central nervous system. So there are certain herbs that can be used, such as gotu kola, tulsi, lemon balm, ashwagandha. So these are herbs that can be used. Omega-3s are supplements that can be used as well, but it cannot be done on its own. It has to be part of a multidisciplinary approach, eating a balanced and nutritious diet, sleeping, exercise, know when you have to use certain herbs. Understand your stress levels, understand your stress coping, enable them, be proactive, take that time to help that nervous system regenerate and recuperate.
Always, thank you very much for your time, Dr. Asante Le Blanc. Finally, just remind us of the contact numbers and your website so persons can certainly check you out at Victoria Clinic.
Oh my gosh. Yes. So our website is www.victoria-clinic.net. Our telephone numbers are 622-2221, 622-0683. Our Instagram handle is at Trinidad Tobago, at Victoria Clinic _ Trinidad. Sorry, that's a different handle. And my Facebook handle is at Victoria Clinic. Contact us, reach out to us. JD has told me that we have other topics. Thank you for sending in your topics. We will address them. Truly be safe out there. Please be responsible. No stigma against COVID-19 positive patients. Please speak to your physicians. They will screen you before you go in. Do not get upset. We have a new norm, and please work with everybody, cooperate, and be safe.
Thank you very much, as always, Doc. Thank you for those of you that are looking on. Don't forget to click like, subscribe, and share. This has been another episode of The Live Checkup. I'm JD. Take care. God bless.
Good night.